contractors, pharmacists, pharmacy managers. And thanks, Kate. The meeting will be recorded as well. So for those colleagues that aren't able to join this evening, it's always available on our website along with the slides as well. So last month's open house surgery is available for you to view, including the slides, and obviously watch back as well. So I'm going to crack on because there are a few things that we need to work through. So I'll just go through a couple of things. As I normally start with, just a gentle reminder that you can join us on our various platforms on social media. So we are now live and regularly posting content on Facebook, Instagram, and LinkedIn. Those are the links there. I'll put them in the chat throughout this evening as well. So if you want to pick that up, feel free. There's also the WhatsApp pharmacy group that we have as well. So if you're not currently on that WhatsApp group, and I will regularly post news, reminders, and just to keep you in the know of what's going on within LLR on the WhatsApp group. And if you're not currently on, or if you know somebody that potentially would like to join, or you think it's probably worth them joining, if you can just contact me or pop their mobile in the chat, and I'd be more than happy to add them to our WhatsApp group. So a couple of things on the agenda this evening. Appreciate we've only got an hour today as well, so I will go through them, and I'm really pleased that we've got a couple of guest speakers with us today as well. So I'm going to start off by giving you an update from Community Pharmacy Leicestershire and Rutland. Excuse me, these are standing items, excuse me, and also just give you a brief synopsis on terms of our work streams, both regional and national as well. And then I'm going to hand over to Sandra and Laura, who have been supporting myself behind the scenes in terms of implementing shared care records. So Laura is the LLR Care Record Programme Manager, and Sandra is the LLR Care Record Benefits and Change Manager. And like I said, we'll be collectively discussing shared care records this evening with you all. It's really important that we use this platform, the Open House Surgery, to hear from you. And we want to hear what's important to you and issues and matters that are arising for you as well. So at the end of this, there's always the opportunity to discuss organically, highlight any issues. Sorry, I've got a frog in my throat. Sod's law. I was fine 5 minutes ago. But just in terms of what you'd like us as an LPC to really focus and work on as well. So we'd love to hear from you. So let's move on into our update. So I did go through this last month, but I felt it's probably worthwhile just reiterating this point, simply because I feel that we might have some new faces join us today that weren't on the call last month as well. So from the 1st of July, we have a new committee that's been appointed into Community Pharmacy Leicestershire and Rutland. We also had a new constitution that was implemented, and that was voted in favour by you, our contractors, as well. The new committee compromises of 10 members, 6 of which are independent, and there's 1 AIM, Rahul, and 3 CCA members as well. So all of this information is available on our website, so I'll continue to signpost our website. And Kate, if that's okay, if you can just maybe pop the links in the chat throughout the hour, that will be great as well, just to help me. That'll be brilliant. We did hold our first committee meeting with the new committee on the 1st of September. And as a result of that, we the committee took a vote to elect a new executive committee. So internally, there's been a couple of changes, and I just wanted to highlight them to you. The first one is Altaf has stepped down from chair, although he's joined us today, and great to have him. He's no longer our chair, and Viral Patel was elected and appointed chair for the committee. Viral, from the previous slide, you'll see is a CCA representative and a Boots manager as well. So great to have Viral on board, and I'd like to take this opportunity to really say thanks to Altaf for all the hard work and dedication and support that he's brought to the LPC over the last few years, not just in his chair role, but obviously other roles as well. That's not to say that we'll see the last of Altaf, because Altaf is still on the exec committee and is now our treasurer. So I'm still really excited to continue to work with Altaf closely, and he'll still be clearly involved with the goings on within the committee as well. And then for those of you that know Sat, Sat was our previous vice chair and continues to be remaining as vice chair as well. We did also at the meeting go through our subcommittees and implement, or should I say, appoint our subcommittees, which involve governance, HR, finance, and our contracts committee. I'm not going to rattle through each of those names, but they are all committee members. But from a perspective, we are on board and fully compliant with our constitution in terms of ensuring that those subcommittees are now implemented and fully embedded as well. Last month, I did talk to you about the TAPAR programme, which was following on from the Right Review. So if you need to remind yourselves of what work we've been working on as part of that's connected to the re-election, the constitution, and appointment of new committee, please refer back to our July slides as well. Like I said, we're on social media, so please do follow us, like us, and share our content. So again, those links are in the slides, but we'll pop them in the chat throughout. So on a local level, what's been going on? Well, something that I came across just over, I think it was last week actually, and I thought this is quite an interesting scenario, and I was really keen to share this at the open house today. But this is actually from a pharmacy, the scripts, and I've tried to blank out so they're completely anonymous, but a pharmacy contacted me to say that they're getting not the pharmacy, sorry, LPT. So Leicestershire Partner Trust are receiving several scripts that are being rejected due to queries from different community pharmacies because the prescriber's name is not included on the EPS. Now you'll see that on the token there's Zacatin XL 18 milligram, which is a controlled drug, and LPT came back to me and said, well, we've checked regionally and with BSA, and there's no need to include those details. And can you just double check? So, you know, that kind of threw me, and from a practice element as well. So I just wanted to share some learnings with you. So that was the problem, well, that's the query. So where do we go from here, and what's the right way of coming around this? So I did approach Alistair over at Community Pharmacy England, and I spoke with the regulations team there and explained that on the issue of whether the prescriber's name must appear on the controlled drug prescription. And very surprisingly and interestingly, the answer is no. So you might, I mean, I can't see any faces at the minute because I'm sharing my screen, but it may be something that you already know, maybe something that you don't know, and I thought it'd be worth sharing that. So the address and indication of the kind of prescriber is required, but not explicitly the name. So I expect some might choose to add the CD registered prescriber name, but that also may not be required, but may be good practice. And again, that was a big learning curve for me as well. The prescriber type may be within the EPS message, even if it's not printed on the EPS token. So the signature for the EPS prescription is, of course, the advanced electronic signature implicit, and is also associated with whichever individual prescriber. So the prescriber had a required smart card to generate the prescription, of course, as well. And arguably, the electronic signature and existence of the EPS script provides more security than sight of an ink signature on paper. So, in short, the name of the prescriber doesn't have to be on the CD prescription. It's good practice to obviously include that on your CD prescription, on your CD register, or annotate that. But that was I wanted to share that almost verbatim following my conversation with the regulations team at CPE. So I'm more than happy to share these slides, and they will go on the website as well. But like I said, it was important that I share that with you because that was something came to me a couple of times last week and just seemed to be a hot topic that I wanted to share. Moving on and completely, moving from CDs to the PCOT plan, which is a delivery plan for recovering access to primary care. Bit of a mouthful, so we abbreviate that to PCOP. So if you recall back in May, Rishi Sunak and the government promised the NHS £645 million investment into community pharmacy over the next 2 years. And as part of that announcement, included expansion of services within contraception and hypertension case banding services as well. Also, as part of that, the announcement, still some more detail to follow as well. So we're getting this in dribs and drabs as a trickle of information, but it hasn't come out completely, and it seems to be quite imminent. But that expansion in the oral contraception blood pressure service is due to be likely, but no later than the 31st of December, so by the end of the year. In that same announcement was also announced the Common Conditions Service, which was formerly called the Pharmacy First service, which you may have heard about a couple of months ago when there was lots of negotiation and discussions in the media between media and CPE. Common Conditions is looking to be launched by the end of the year as well, but likely by the end of October, we're hearing as well on the grapevine. So for those of you that are completely au fait and aware of extended care services, it does overlap with the existing extended care pilot that is Midlands specific. It includes uncomplicated UTI, impetigo, infected insect bites, and acute otitis media. And those 3 that I've highlighted in red are 3 new conditions that will be coming in as part of the Common Conditions Service. So shingles, sinusitis, and sore throat as well. Like I said, we're still waiting for a lot of information on what this would look like and what that means for you as contractors. And really importantly, when exactly we're going to start this. We're still waiting for more details around the 645 million investment into community pharmacy in terms of how is it going to be, when is it actually coming, and precisely how will it be deployed as well. So probably more questions than answers at this point, but something really important for you to be aware of, particularly around the timescales of that. In terms of work streams, well, a couple of things. In the background, there's a lot of work happening with PQS now. The PQS for this year has been reduced significantly. We have 1 gateway criteria around NMS, and there are 3 domains around medicines optimization, respiratory, and prevention. There's quite a lot of information now on, and I've put the link on in the purple on the right-hand side. And to qualify for PQS, contractors will have to meet the gateway criteria by the end of the 31st of December 2023. So Gareth and Vinay will obviously continue to do their visits and work with contractors as well, but we'll be sending out a number of reminders with regards to all the deadlines associated with each of those domains as well. The claiming period will be between the 5th of February and the 1st of March as well. And we'd strongly urge all contractors to ensure that they complete PQS by the end of the year. In terms of services, focusing on DMS, and great that we've got Paul Gilbert joined us tonight as well. Paul's really supported myself and Gareth with getting this up and going, but we're really pleased to announce, and having spoken to you many times around DMS, we've managed to coordinate a training event on the 11th of October. This will be a face-to-face event, so not an online event. It's a face-to-face event in the evening at Glenfield Hospital Clinical Education Centre. It's not just a community pharmacy training event either. It's a community pharmacy, hospital, pharmacist and practice pharmacist event. So we're really trying to triangulate all 3 points so that we're all singing and we're all very clear of why it's important and what good looks like and what each of us are responsible for doing as well. For us, it's obviously an essential service, but we really need to make sure that we're working in coordination and harmony with our counterparts as well. So That information is now available on our website. If you are speaking to your practice pharmacist, please do encourage them. I know Paul's obviously going to send some communication out to practices as well, and comms has already gone out to various stakeholders within ICB and UHL and LPT already as well this week. Other things that we've been working on, or Gareth's been working on, unfortunately Gareth's not here today, but would have loved to have joined. He's on annual leave, but Gareth's been really busy in terms of updating a lot of the resources and information that's available on our website. So he's added a wealth of resources on the website, including training to support you with regards to blood pressure checks. There's blood pressure service resources for pharmacists, and he split that out to blood pressure service resources for surgeries as well. We've also been working on ABPM service support as well, and at the moment we've got support manuals and resource for those of you that have got ABPM devices with A&D, HingMed or Meditech as well. And linking that to the AGM, really pleased to say that we've got HingMed and A&D joining us as well at our AGM next week on Friday evening on the 29th. So if you do have an A&D or HingMed ABPN and need some help or assistance around that, feel free to bring it into the AGM, but make sure that you're registered as well, and there'll be support there on site for you as well. So CPCS, I'm not going to say a lot about CPCS. I felt that from last month, there was a lot of questions around CPCS and not receiving referrals, which I know that I've had a handful of contractors contact me since saying that they're not receiving referrals either via 111 or just from their GP practice, and it seems to have been a DOS issue. Paul Gilbert's obviously been supporting those contractors and managed to find out where that issue was stemming from and supported them to ensure that referrals do come through to them now. So again, if you are a contractor and not seeing referrals or any referrals, then we could explore that to find out whether it's either the lack of referrals, it is a genuine lack of referral to your specific pharmacy, or is there an IT issue going on there, and we can investigate that as well. But I felt it was important just to share this, the results in terms of the data, where we are compared to a Midlands region as well. So today, as a region in an LPC, LLR is the highest CPCS performer in the Midlands. So we know that referrals are coming through on a month-by-month basis. We've had some peaks and troughs and quite a bit of a journey as well, but it's looking incredibly healthy. So really pleased with the results as well. And obviously we've had implementation and embedding of Farm Refer as well, Farm Refer, and that work is still ongoing as well. So staying on CPCS, just to remind you, there's a toolkit which is available on our website. You should all have received the hard copy by now, but you can obviously download excess copies on our website. And the toolkit really is designed as to support you and enable you as a conversation starter with the surgery as well. With regards to CPCS as well, I've also been in contact with a number of you with regards to ensuring that you've declared your provider in terms of your IT provider, and your IT provider pays. So I've been chasing you up on that. I've sent out an email and new follow-up emails as well. But ultimately, if you're with Pharma Outcomes or whichever provider, you need to inform them that you are with them and providing CPCS as well. If you have no idea of whether you are or you're not, please contact me and I'll be more than happy to check whether you're on that list or not. In terms of other contractor resources and support, we continue to send out the newsletter, and I believe the newsletter went out to you today. The deadline tracker for the month will also be with you very soon this month as well. And then a couple of new things on the website, new additions, regional correspondence. So you can see what regional correspondence we've sent, particularly in terms of any lobbying or letters or communication to CPE, namely Janet Morrison, or anything else around stock issues, procurement, workforce, etc. as well. Two more additions in terms of our website as well, including number one, report an issue. So I spoke about this last month as well. So if you have an issue as a contractor or as a pharmacy or as a pharmacy manager, pharmacist, and you want to report that to us, then feel free to use that form. And it's a very simple web form, takes no more than a minute to complete, and it will come straight to my inbox, and I'll contact you as soon as I can. There's also the mechanism to contact directly the chief officer myself, and it really allows you as a pharmacist, pharmacy manager, contractor to book a one-to-one 15-minute consultation with me to discuss whatever you need to discuss, whether it's highlighting sector-specific issues, matters arising, but it also enables and helps me to keep my ear to the ground as well. So please do make use of that. It's free. Takes literally less than a minute to complete the web form, and I strongly encourage all contractors to utilise these tools that we've set up to enable you to provide us valuable feedback. So events planned for September and October. We have a lot going on this month and next month. So I thought I'd just take a couple of minutes to give you a whistle-stop tour of those events and remind you. We will send out reminders, of course, via email. But the first one is our AGM. So our AGM is happening next week on Friday. It's an evening event, and it actually starts from 6:15, where there's a buffet provided as well, and we do have a number of our sponsors joining us with stands to provide you with information and resources that we hope that you will find helpful. The AGM will be held at our Hotel Brooklyn in Leicester, so quite a central location. There is also parking available, and in order to register for tickets, which are now available, just use that link, which Kate will pop in the chat, or I'll pop in the chat shortly, with Eventbrite as well. It's open. The AGM is open to pharmacists, pharmacy managers, pharmacy teams, technicians and superintendents and area managers, of course, as well. And like I said before, there is going to be A&D and EMT available there on a stand. So if you have either of their ABPM devices and need some support, or whether that be technical, then feel free to bring your device in as well. Second event that we've got going on is the Controlled Drugs webinar, which is actually with Amit, the Accountable Officer for LLR. Very timely as well, particularly given that I just spoke to you earlier on about the LPT issue as well. And that's also something I've discussed with Amit as well. So that's happening next week on Tuesday. It's an evening event. It's virtual, so you can join via Zoom like you are doing tonight. That's open to all pharmacy team members and pharmacists, area managers, superintendents as well. It's going to be a session that's also supported not just by Amit, but also Turning Point as well will be joining. So great to have both working together on this on behalf of Community Pharmacy Leicester and Rutland as well. Taking that one step further, in October, we have organised an evening with our LLR GPHC inspector, Richard Chapman, and I'm sure you all know Richard. But we've heard from the grapevine, but also through various media reports as well, and you've probably seen them as well. You know what I'm referring to. In terms of inspection reports for some pharmacies, and getting quite bad press, undoubtedly. So really it's to equip you to ensure that you as contractors feel happy and ready and are fully aware of what happens during an inspection as well. It's an interactive session, and I've specifically asked Richard to make an interactive session. So he'll obviously do a presentation, but it's also an opportunity to ask questions to him as well. And he'll do his best to give you the best support and advice and resolve those issues as well. So again, that's open to all pharmacists and pharmacy managers and pharmacy team members, really. So I hope you can pop that in your diary to save the date. Just gone through the DMS one already, but just to reiterate, you will need to register for that event as well. And there is a QR code there as well, and the registration link is in the on my PowerPoint slide here, and it does involve not just community pharmacy, but also hospital and practice pharmacists as well. So we're bringing all three together to discuss, and hopefully a better way and a better approach from a coordinated approach looking at DMS. And then for those of you who aren't aware, did you know on Monday it's World Pharmacist Day? So happy World Pharmacist Day. It's a time when we pause to celebrate and be thankful for all that we've achieved as a profession. But more importantly, and just as important, I should say, the amazing work that you and your pharmacy teams do every day to enable people to stay healthy as well. So there's going to be there's a couple of visits happening from ICB colleagues into some of our community pharmacies with an LLR as well, and there'll also be some social media news stories as well coming out on Monday and just before as well. But just to give you the heads up, it is World Pharmacist Day on Monday the 25th, so there will be quite a lot of information coming out from ICS as well. And of course, we'll continue to have our open house surgery, which happens on the third Wednesday of every month as well. Please do spread the word. I've kept today's content quite light. I think last month's was probably a little bit heavy, but we do have Laura and Sandy joining us as well today, so hence why it's a little bit lighter, but great to have them on board as well. And finally, just to finish off with just our contact details as well. So unfortunately, I have a team around me. Kate's our administrator. She's joined us today, this evening. We've also got Gareth, and that's his email address. And we've obviously got Vinay, who's our service development lead as well. If you need any help or support, feel free to contact one of us, and between us, we'll try and signpost you in the right way and resolve the issue that you have. We'll try and support you in any way. Thank you. Now, before I go into shared care records, I'm just going to stop sharing my screen and see if there's any questions for me. Any questions, any comments?
Hi, everyone. Just want to say thank you. That it's nice to have this all sort of the highlights in one slide and in one evening. So I really appreciate that. Thanks, everybody. Thanks, Raj, for putting that together.
Thanks, Nadia. You're welcome. Okay, I can't see anybody else's hand up or any other comments, so I'll try and make sure all the links are in there. But Sandra, can I come to you? Is that okay if I come to Sandra? So are you there,
Yes,
Sandra?
thank you, Rajshri. There are actually three of us from the team here today.
I'm sorry.
No, that's okay. That's okay. So we've got myself, I'm Sandra, and I am Benefits and Change Manager for the LLR Care Record. But we also have Laura, who, in fact, I'll let her introduce herself.
Hi, everybody. I'm Laura Gottschalk. I'm the Programme Manager for the Leicestershire and Rutland Care Record.
And Toby.
Hi everyone. Sorry, I'm Toby Page. I'm the architecture lead for the programme.
So thank you for having us today. What I'll do, with permission, is share screen for a few slides. We also have a short video today, which we'll try to play. Let's see how we get on, because we might succeed or not with the sound. So let's see how we go. But I'm going to hand over to Laura to jump in while I hit share screen.
Wonderful. Thank you, Sandra. Yes, so the Leicestershire and Rutland Care Record, and we'll take you through sort of the ins and outs of it throughout this sort of couple of slides we've got to go through, is the Shared Care Record solution for Leicestershire and Rutland. And the Shared Care Records are a national mandate which started from sort of quite a few years back now, but from 2021 we had to have a technical connection to our main healthcare partners initially, and then social care. We took the initiative to join health and social care at the same time, which was quite unique from sort of a national viewpoint. And we had Rutland, who were the very first of the ICS organisations to be connected into the live environment and sharing information in and utilising it as well. We'll go through a little bit more in detail about where we are with users, how many people are on it, and sort of the future view as well, and also what it looks like and the type of data you might be able to see in that. It was really lovely to have the LPC sort of engaged with this from the very start, and actually the interest of being connected in for pharmacies to have access to this was something that sort of came forward from the very start of the programme, which is really great to have had Rajshri and Sat involved in this, and also inputting up to date, where we've you know, we're trundling along now on getting connection into systems you're already using. So we're going to just shortly play a 90-second video, which gives you a bit of a flavour of what the LLR Care Record is. We'll also send you the links on how you can access this to share with your teams, give them a bit more information. This is all available publicly as well, and also all of our documentation is available publicly, and we'll share with you later on how to access this. So let's see if we can click play and see if we can get the sound to work.
It's common for treatment and care to be provided by several different organisations. This can mean that your records from each visit are also stored in separate places. Sometimes, only health and care professionals within the same organisation can see this information. If you receive care elsewhere, your records may not show your full history. To solve this problem, local NHS and social care services are working together to implement a new approach. It's called the Leicester, Leicestershire and Rutland Care Record. This care record enables health and care professionals to access information about you to improve your care, even if they work for different organisations or in different locations. All records are strictly confidential and can only be accessed by clinical and care staff who are directly involved in your care. Having your information viewable all in one secure place means joined up and safer care. At the touch of a button, the professionals providing your care can make better informed decisions. They can see a bigger picture of your health and care needs, and with reduced paperwork and fewer phone calls needed across services, more time can be spent looking after you. It also means you are less likely to have to repeat yourself every time that you access a health or care service. Linking up care better between your GP, community health services, social care, mental health care, and your local hospital. That's the Leicester, Leicestershire, and Rutland Care Record. You can find out more by visiting our website.
I'm glad that that worked. Usually we do most presentations through Teams. It's not often we do Zoom, so it was a bit iffy as to whether it would work or not. Next slide there, please. Then Sandra, if you can shift over to it. Wonderful stuff. So looking at sort of connecting community pharmacy into the LLR Care Record then. So Community Pharmacy Project, like I said earlier, was initiated by the LPC right at the very start of when our programme was initiated under the ICB. We are aware there was a small grant that was obtained to help progress access to community pharmacies, and around sort of the communication around that, and we're looking to hold some events around sort of how to connect in and what we're doing. There's been a good collaboration with the LLR Care Record Programme team, and we've been looking at sort of use cases in what sort of information you might need to see, especially as sort of more there's more connectivity to working more closely with the GPs and potentially getting referrals and things along those lines as well. You know, is it medications that you would like to see? Is it existing conditions? And really kind of drilling down on what that looks like. We had sort of confirmation from this that it is worthwhile to connect in community pharmacies to see information, and there was clear drivers for use cases and the potential benefits. So we're a very benefits-led programme. And unless something is going to release value to yourselves, then you know, we wouldn't be comfortable with releasing it. But it has, you know, there is quite a few benefits that come through from a community pharmacy side. The system itself is really simple to use, and it's secure. we have a huge IG work stream, cybersecurity, clinical safety from a clinical safety officer sign off as well. We're rolling out currently across many LLR organisations, and we'll have a bit of a look at those later. But the main initial ones are UHL, LPT, the 3 local authorities. Loris as the local hospice or the larger hospice has connected in. We'll be looking at connecting in Rainbows at a later date as well. Obviously yourselves with community pharmacy. We'll also be looking into a wider picture of looking at care homes, potentially voluntary sector and other areas that may well be contracted to provide services within LLR as well. Sensitive data, like I said, for qualified and clinical staff and members of the public. So how it shows information is for people that you are working with, and it will only show you within the people within the LLR footprint effectively. So it looks at the PDS registrations of those and only retrieves those within an LLR footprint. There is a simple centralized public to opt-out process. So if you did have any people that wanted, or public that want to opt out from their information sharing across the LLR care record, then that's easily done. And the access of the information on how to do that is on our website as well. But it's one of those things of, there still will be sharing done through normal means such as telephone, or, how people are normally doing it, the slower version, and just not sharing through the LLR care record will just mean that slower process. So we'll be looking at doing pilots soon within community pharmacy. We're looking to you guys to ask if you would like to be an early adopter of this. We're looking at diverse community pharmacies, different sizes, large, small, a different range of services. We're looking at those particularly that provide a lot of services will probably gain more value from this as well. But we're happy to kind of look for anybody that's generally interested and wants to get on board. The onboarding process itself is really quick and simple. We do an hour's online training, but we also have a lot of other training methods as well, such as YouTube videos, one-to-one sessions, group sessions. We can provide all of that. It's at no cost to yourselves as well. We have information sharing agreements that are being signed and we'll look at as a collective. So there's one for all, and we take that approach with all of the information sharing agreements across the whole of LLR. We enable a link. So we're currently in the process of doing what we call a contextual launch. So linking through from a system you already use. And we've picked Pharma Outcomes as that system. It seems to be one that everybody uses, and it will enable a button within Pharma Outcomes for you to click on, and then it will direct you straight through to the LLR care records. So that's something we're working with Pharma Outcomes at the moment, and they're hoping to have a demo to us within the next couple of weeks, which will be great. And we always work on a feedback and returns or system. So we want to make sure that we're confirming you are releasing the benefits we're expecting to happen. And we go through what we think those benefits will be with yourselves to be able to ratify those. And we look at monitoring those as well going forward to make sure it's still receiving benefit, or if there's additional data that you may well want to see as well. So that's a really tiny brief intro. I'm going to hand over to my colleague Toby now to give you a little bit more of the tech side of things. Go for it, Toby.
Thanks, Laura. So so in terms of how this works, I mean, we're connecting to a number of different systems across the region, and they feed in information in various forms that they're displayed in the portal. And as Laura mentioned, we expect that to be connected via a context launch mechanism via Pharma Outcomes. So as you can see, there's systems like Liquid Logic for adult social care, System 1, Clinicist, Nerve Center, all feeding in. So we're kind of pulling that through, and it'll be shown in one place. So the information is all shown together at the bottom there. So this is a bit more detail in terms of what we're actually sharing. So obviously we're getting information from our national sources for primary care from the GP practices. So they're coming from both EMIS and System 1. And there's the range of information on the left. They're shown in a kind of a standard view that consistent between both EMIS and System 1. So that's shown in a separate area currently. We are working on what's called structured view of this information, where we'll pull those bits of information in alongside others. So you'd see the meds all together with medications from other other providers, but at the moment they're separate. And then you can see a range of things from UHL. We're getting information about encounters and appointments, people's attendances at A&E, for example, and the GP assessment unit there. And then LPT, we're getting information relating to discharge, so medications, allergies, and document discharge summaries. And we've also got connections to the non-GP units for System 1 as well, which are coming through. We're just doing some final testing on that. And then moving over, adult social care, we've got all the 3 local authorities connected, and they're sharing information about the packages of care that are being provided to people. And this information is going to be, we'll be extending this to include lots of other things in the future, according to the benefits that they can provide. And then finally, at the end, we've got MediQuip, which is information about what equipment people have for them at home, to support them at home. And then finally, virtual wards. And we've been working with Spirit Health, who's one of our virtual ward pathways suppliers. So the information that is recorded by patients at home when they're on a virtual ward, we're sharing that into the care record, so people can look at the observations they've captured and any questionnaires. Yeah, so I think that's where we are. I mean, obviously this is the picture at the moment. As things are developing, we'll be extending this to include lots of other information as we hear about the benefits. And this is a quick kind of a view of what it looks like. So the information drops into these kind of containers for different resources generally. Potentially you can get multiple information providers per area, if you like. So you could get medications from different places, documents from different places, but it obviously shows you where that's been derived from. And you can see there where the arrow, the hand is, the GP data in here. We've got those areas that were listed before. So this is straight out the GP record. It's a dynamic view. It's always live into GP systems. I don't know if there's another. That's back to here. And then, yeah, this is the medications that are, so for example, we've got LPT medications that relate to discharge meds at the moment. So they come direct from LPT. And there's more information about those. We are, probably extending some of this information actually from this screenshot to include a bit more detail, but that's being finalized at the moment. I think that's me.
Thanks, Toby. So you can see there's a lot of rich information being shared, and I sat down with Rajshri actually a few months ago, and she talked through with me the sorts of activities that you're undertaking as community pharmacies, and how having access to this information might just improve your day and improve the care that you're able to offer. So just by way of illustration, so she talked to me particularly about the amount of time that you have to spend sort of trying to get information, especially from the GP practices. So your gain there is twofold, because not only can you just directly see that information, but also you're not having to break the flow of the transaction or the job you're trying to do, because you can just get in the flow with it. You don't have to wait for the GP to respond to you maybe later that day or the next day. So real benefits from having that direct access means you can serve the customer more rapidly and efficiently as well, so that they don't have to go home and come back tomorrow potentially. Med safety is also at the heart of everything, isn't it? The whole business of managing risk and putting you in a better position there, as well as helping you to offer more rounded advice with more confidence to the people who are popping into the pharmacy, because you've got that bigger picture. Rajshri was talking earlier about work on discharge medications, and that's another area where having that visibility could be incredibly helpful, as well as sort of intervening where people maybe are accumulating, they're in a polypharmacy situation, and maybe not everything that they're rattling around with is necessary for them, and just supporting you with that. Obviously, the use of antibiotics is an important agenda. And then also as Raju was saying again earlier, the extended services that pharmacies will be providing, actually having that greater set of information will let you spend more of your time actually deploying your professional skills towards those tasks, and actually in a way sort of supporting you in really strongly positioning community pharmacy as the skilled service that it is. So in terms of time savings, I think this is incredibly powerful. If you were able to shave 20 minutes off a day by having more efficient access to vital information, that actually stacks up to 2 working weeks in a year that you can spend working more effectively with the customers that you're there for. And at the same time, improving the care that they receive and the service that they receive, and reducing the burden on GPs, which is impacting again onto people's health and the wider health and care system. I just also wanted to flag that at the same time as it's supporting you and supporting the wider system, the public benefit in a whole range of ways, not least having less burden on themselves for having to remember and repeat all the details of their medications, their conditions, and so on. So lots of benefits all round from rolling out the LLR care record. So you might also be interested in how we've been informing the public, because at the same time as we're rolling out, it's really important that the public are aware that this tool is coming. So we've done all sorts of campaigns, including on social media, where there have been more than 500,000 views. And we're finding that overridingly the response is positive, and people are saying, well, listen, you know, this is a thing which is very welcome, and the more widely used it is, the better. It supports everyone wins. So there's also a whole range of resources which you can also look up. We'll share these slides with you afterwards, things like leaflets, all sorts of extra information, the animation which we showed you earlier on. So I mean, we've given you a bit of a whistle-stop tour there around the care record and what it is and where we're going, and we would really warmly invite you to jump in and get involved and come with us on the journey. So I don't know if maybe you have any questions, but I'll stop sharing now so that we can see each other and maybe pick up a bit of a conversation. Thank you.
Any comments, any questions? Feel free to jump in or raise your hand. Stunned you all. Nadia, coming in. Thank you.
There was a mention about farm outcomes being introduced and the button for the shared care record. Does the smart card need to be attached for that to be accessed? That question makes sense.
Yeah.
That's a really interesting question, actually. We are still working through sort of the process with them. We believe that if it's something you're already doing and you're putting your smart card into access pharma outcomes, then you would still do that, because that's how you're accessing pharma outcomes, the system, to use that. But with the LLR care record button within that, it will take your credentials from that and know who you are to pass you through. So it will know you have sort of access rights to go through to the LLR care record. So they are going to provide us with a bit more of a breakdown of the ins and outs of what they've built. Like I said, we're still waiting to see that. We should have some more, we should be able to see it within the next couple of weeks, actually, and then be able to work through any bits exactly like that on whether we feel certain parts of it will need to be tweaked for our users, or whether that will work with your existing processes already. So that's something we can confirm with you shortly, if that's okay.
Thank you.
Thanks, Laura. Thanks, Nadia. Ron, do you want to come in?
Thanks, Rajshri. Yeah, so it's not a question, it's just a comment, really, just to say really interesting presentation. Thank you to the three of you for putting all that together for us. It's probably a really obvious thing to say, but, you know, we have a pharmacist and their teams talking to patients all day, every day. And we try to make informed choices and help our patients make informed choices about what they need to do to take care of themselves. This is a really long overdue way, isn't it, of having more information for ourselves and our pharmacy teams to make that better informed choice as well. So yeah, I think it's great, and I think a lot of the people on the call and off the call are also going to think the same thing as well. So yeah, thank you for the support you're doing in driving this forward for us. It will really make a difference to the way that we can care.
Brilliant. Thank you, Ron. Yeah, no, absolutely agree. And I think pharmacies are, I think to the public as well, are always kind of, there always seem to have felt like a bit of a blurred line between them seeing pharmacies as a healthcare provider or a retailer almost. And it's nice to kind of have that where they are being seen as providers and as somewhere somebody can go, and that's really pushing that. And you guys having access to see this wider picture as well really supports that narrative. So yeah, it's brilliant to have sort of the backing of the LPC and the pharmacies within LLR.
Thanks, Ron. Thanks, Laura. If there is any contractor pharmacists on the call today, or you know of any pharmacy that's interested in becoming a pilot, this is where we need your help. If you want to become a pilot site, then feel free to drop me an email or a message, WhatsApp, and we can get the ball rolling as well. Really pleased that Laura and Sandra and Toby have been here this evening to join us and just kind of give us a light touch on the shared care records. There's been a lot of work from Laura, Sandra and Toby behind the scenes as well. So, immense thank you for that. But we really, it's over to us really if we want to make this work. This is something that we've been asking for years, actually, the shared care records, and I've popped it in the chat, just some information in terms of what it will give us access to, and just things that we don't know why medicines are being prescribed, so we kind of take a hunch, take a stab, and we don't actually know. So a simple thing like antibiotics, we don't necessarily know why they're being prescribed. Timely vaccination information as well. How great would it be to know? How great would it be to know what vaccinations they've had, their schedule, etc., and blood test results as well. So as part of that, this starts to think. If you think about the role of pharmacists and pharmacy, it starts to expand our role on a more clinical setting, so we can interpret those blood test results as well. So Rishi talked about expansion of community pharmacy when he made that pledge back in May with regards to the 645 million. But this is really our time to take, to really own this. So if you are interested, please do, put your name forward to me. If you think that there's other pharmacy contractors that aren't on tonight's call that would be interested, please let them know as well. Really pleased that Laura, Sandra and Toby are going to be there or joining us at the AGM next week as well. Hopefully we'll get more interest and get the ball rolling as well. But thank you. Thanks, Laura. Thanks, Sandra. And thanks, Toby. Okay. Just conscious of time, and literally that's bad timekeeping on my side. So apologies. We've literally got 5 minutes, but I know that we've got Paul on the call as well. So Paul's obviously our community pharmacy clinical lead from the ICB, a bit of a mouthful, and I think I deserve a round of applause for getting that job title correct at this late in the evening. But that said, Paul, is there anything you'd like to say to any of our contractors that have joined this evening? You're on mute. I can't hear you. No, I still can't hear you. No, I don't think it's me. I still can't hear you. Sorry, Paul.
I don't think it's you either. Nobody else can hear him.
Okay, that's good. Sorry, Paul. Okay, so it's you. Yeah, it's down to you. Sorry. Okay, no worries. Paul will type in the chat if need be of anything. At last month's open house surgery, we did speak about CPCS, and just in terms of contractors explaining that they were finding it difficult to get their foot through the door at practice level as well. So I did speak to Paul offline after the open house, and Paul very kindly has said that he's happy to support any contractor that's finding it difficult to get their foot through the door as well. So it's really important that I reiterate that, and Paul's nodding his head. So if you are experiencing difficulty, then please do take Paul up on that offer as well. Paul's also supported, like I said, when I was talking about CPCS, a number of contractors who were having difficulties receiving referrals, and it turns out there's been a glitch in the DOS setup for those contractors as well. So if you are concerned that you're not receiving any referrals, one of the reasons could be because of legitimate no referrals being made to your pharmacy. So my first question would be, have you actually engaged with the community, with the practice, using some of our toolkit resources? Or secondly, if you're still not receiving any following that, then let's have a look at to make sure that there's no IT bugs in terms of the DOS setup as well. In terms of the IP Pathfinder, that closed, the EOI closed on Monday. I believe Paul's now collating those responses, and will have a report by, is it the end of the week or is it next week? Sorry, Paul, if you can just give me an indication in the chat, because I know that's going to be quite a thing, probably around 2 weeks. Okay, that's fine. But Paul will obviously communicate that in due course. Through chat. That's okay, don't worry. So Rahul, in about 2 weeks or so, but I'm speaking to Paul more or less every other day, so I'll find out a more definitive timeline on that as well. So that's a little bit about Paul, and Paul's just added his email address in the chat, so thanks Paul on that. Really conscious that it's almost 9 o'clock, and I don't want to take up too much of your evening. Is there anything any of our contractors or pharmacists want to raise this evening, considering you've got myself, Paul, and some of the committee members as well online? So don't be shy, feel free to put your hand up, feel free to just join the conversation. Anything you'd like to highlight to us as a committee as well, or as an LPC that you'd like to see more work on or want to know a little bit more about? No. Okay. Any questions? Any comments? You're very quiet this evening, whereas last month you were all very chatty. So it kind of comes in roundabouts, really. No problem, Paul. We get it. It's okay. These things happen. It's not an issue. So if there's no comments or feedback, just want to say a big thank you for joining us this evening. Kate will get the slides up, including the shared care records slides up on the website, along with the recording from today's open house surgery. If you are interested in supporting and becoming a pilot site for the shared care records, please do contact me via email or via whatever, WhatsApp, call me, and we'll start getting that list collated, and I'll forward your details on to Sandra and Laura and the team as well. But if there's nothing from anyone, I'll stay online for a short while, but if you want to, feel free to jump off, and a big thank you for joining us this evening. Thank you. Have a lovely evening.
See you later.
Thanks. Cheers.
Bye.
See you.
Thank you, Ranjari.
Thanks, Ron. Thanks, everyone.
Thank you.
Thanks, Rahul. Thanks, Sandra. Thanks, Laura. Thanks, Toby.